Experts say nothing beats mother's milk for babies, but of course not all moms can produce breast milk, and that's where breast milk donors come in, and we're talking about that today with Dr. Elizabeth Mead from Swedish. First up, who needs donated breast milk? Who uses it?
Yeah, good question. So we know that all babies benefit from breast milk, but babies who are born early, premature, or very low birth weight are particularly at risk, so they really benefit from donated breast milk.
And is there a shortage right now?
There's never going to be as much supply as people would like to have, because I think for any infant that's not able to drink their own mom's breast milk, then moms often will want to have donated milk, and so there's not enough for that right now.
Right. And the benefit of breast milk or formula?
Yeah, so formula is fine. It helps babies grow. Babies that drink formula do just fine. So I don't want moms to feel guilt if they're not able to feed only breast milk. But breast milk does have a lot of substances that are really beneficial for babies, not just for nutrition, but especially for preventing infections.
Okay, so the idea of donating your breast milk is kind of off-putting for some people. So just try to demystify it a little bit.
I think it is off-putting, and then I think some people are really into it, so it tends to be a little bit polarizing for people. But you know, breast milk that's donated through milk banks is pasteurized, it's tested for infections, it's just similar to the way that we would buy milk and drink it in the store. You can think about it that way.
Right. You were saying that, you know, think about where your cow's milk is coming
I mean,
from.
it feels a little different, certainly, because I think breastfeeding is such an intimate bonding thing, but I think there's real benefits for babies who need breast milk, and donor milk sometimes is the only way to achieve that.
So how do you make sure that that milk is safe for babies to drink?
So we recommend that you definitely go through an accredited milk bank. So the Human Milk Banking Association of North America is a nonprofit organization that runs different milk banks, and they make sure the milk is pasteurized, it's tested for infections and different substances that could be harmful. We really strongly recommend that people do not buy milk on the internet from unreliable sources. We've heard of moms getting it from Craigslist. It's really something we recommend against, because it can be very dangerous for babies.
Right. And if you are someone who may be interested in donating, do you have to get tested? How does that work?
Yeah, so we would love to have more moms donate. So if you're a mom who just has a ton of milk that your baby's not going to use, or some moms, you know, sometimes the baby can't drink the breast milk for medical reasons, but moms are still producing. So you can go to the Human Milk Banking Association website and find different places to donate. At Swedish, the Lytle Center accepts donations, and then Providence Everett also accepts donations. They screen moms, and then they also test the milk to make sure that it's safe for babies.
Okay. Dr. Elizabeth Mead, hopefully we answered some questions for folks out there. Thank you, as always.